For the team's physicians, many centers offer the convenient advantage of in-center specialist consultants. Specialists like this gynecologist at the Montefiore Center, who is available to consult on specific patient problems, or to refer a patient to if circumstances require.
When have you had your last period?
What, the 12th of last month?
12th of last month. Have they been always regular, your periods?
Yes.
And how long do they last usually?
5 days.
From what
Psychiatric consultations are also possible in the New York Center, and team physicians take full advantage of the opportunity to talk over specific case problems.
Reinforce this connection.
Bite and swallow. That's right, honey. Okay.
One of the most important team members at any center is the dentist, whose facilities are almost always busy.
Okay, honey, shall we practice, and we'll show you how we brush the teeth?
Here at the center, dental care is an important aspect of family health care. Our main consideration, of course, is clinical dentistry. However, we feel it very important to begin a program of preventive dentistry with instructions in diet and nutrition. We begin our preventive dentistry program with the basics, and that is instruction in home hygiene and home care. Our assistants here are trained to continue the program by further instructing the families and the children, especially upon each visit.
Hold the tooth first and do it yourself. Okay? Put it up, then down, up, down.
For incentive, your own toothbrush with your own name on it.
Jose, there you are. Now take your toothbrush, Jose, and take it home with you.
While the family health team makes maximum use of physicians and dentists, each team also draws upon the nurse with public health skills, who knows and is known by her patients in a very special way.
This mother and I have built up a tremendous relationship. I know her family. I've been to her home. She knows the doctors and the family health workers. We're her team, hers alone. I mean, it's people saying, you're that special to us. You know, we're your special team, and we're interested in you not only in terms of the medical aspects, but how are your children doing in school?
Ms. Thompson today is going to tell us how to take an oral temperature while you're doing it.
We said that it was fundamental to center philosophy to involve people from the neighborhood in creative new health roles. And certainly one of the most creative is the idea of the family health worker. The family health worker is typically a woman, though there are expanding opportunities for men in the role, and always a person who lives in the neighborhood and understands its needs, its people, and its community resources.
If the patient is unconscious, you never take an oral temperature.
When they learn such health skills as care of the bedfast, checking vital signs, first aid, and elements of anatomy, and pass some rigorous examinations to demonstrate their knowledge, these family health workers are integrated into the functioning health care team.
Come in sometime within the next couple of weeks.
Consulting closely with the public health nurse, who often serves as team coordinator, the family health worker is given her day's assignments, which can include everything from visiting a bedfast coronary patient to visiting City Hall to get action on a housing violation. For family health workers like Raquel Martinez in New York's Bronx, patient care often begins by visiting in the home, apartment, or tenement. There she can check the entire family in their home environment, not just the mother who is pregnant, but also the children, for whom she may well suggest things like diet changes or better oral hygiene. At periodic intervals, the family health worker makes an appointment for the family at the center. Here in Health Unit number 3, this patient and her children will be given all of the medical attention they require. For the mother, that means the obstetrician.
It's all right. The baby's in good position, and we'll probably expect her to deliver towards the end of the month.
Ella dice que todo está bien con tu embarazo y que ella espera que para...
Please ask Miss Santana, how's she been feeling since the last time I saw her?
El doctor quiere saber cómo te sientes desde la última vez que te vio.
Me he podido sentir en algunos achaques mejor. En cuanto a la vejiga, pues, más o menos igual.
And that's the way it's working at centers all across the country. Team medicine, with the family health worker bringing the doctor what he's lost, the ability to see patients in the context of their home and family, and what he never had, a cultural bridge into the community.
Mr. Belfont, I understand that you're walking now.
Listen again as the family health worker responds to the needs of a patient who happens also to be a neighbor and a friend.
It catches me right in, you know, right in there. Then it goes right on around, right on up under my rib, come right on up it's right to the thick part of my shoulder. I don't like to go to doctors too much. So I've never been no sickly person in my life. And I've come to this clinic more than I've ever went to a doctor in my life.
You done gained some.
And so the patients come to their neighborhood health center. There aren't any complicated eligibility requirements for the patients, no lengthy forms to fill out in cold, unfriendly environments. Top priority goes to serving people. And always patients are seen as people whose health needs are bound up with the other circumstances of their lives. Young Salvador there isn't just an injured wrist. He's a little boy whose mother kept a dangerous washing machine. And one of the first things the center did was to send someone out to his house to share some safety techniques.
And he had much of a cold.
Senor Gallardo there isn't just a heart patient. His doctor knows that he's the head of a large family, and it's important for him to have an income-producing job, a factor which will be taken into account in his treatment.
Sometimes, not all the time, just sometimes.
Yes, I think...
Even Mrs. Hitchcock, who complains a lot, is seen as a tired wife and a mother of 5 who must be listened to and responded to with attention and respect, not only because she needs to ventilate her feelings, but because it allows the center to see where they may not be meeting patient needs.
Doesn't hurt. I said, look, this is my body.
So they listen to their patients both in the center and on the job. If a man can't get off work to come to the center, a center worker will go to him, even in the middle of a plowed tomato field. Can we help you with your family's health problems? That's what they want to know. On the job or at home, center workers go out where the patients are to tell them about the health services available, and they tell it in the language of the people.
Si no me quería hacer una pregunta sobre también.
Sí, todos han estado bien hasta ahora.
Hasta ahora, bueno. Sabe que vamos, entonces sí arreglamos la clase para cuidar a los niños, para darles primeros auxilios, para...
If they live too far to make the trip themselves, the center bus will go get them. The idea that the center must be accessible was top priority from the beginning, and nobody is ever denied care because he lacks transportation. Accessible medicine? It's as accessible as your own backyard to this elderly couple in King City, California. Yes, they could come into the center for treatment, but old Mrs. Bonatti has always had a fear of hospitals, and injections under your own grape arbor aren't anywhere near as threatening. Outreach? Bringing medicine to the consumer, to the community, academic words to describe what really goes on in the Bonatti's backyard. And their appreciation takes a form sanctioned by tradition. Call it corny at your peril. This gift is given with sincerity and gratitude, and it's received the same way.
From the outset, the health center idea was based on the concept of community participation, that residents in the center's neighborhood cared about the kind of service they would have, and that they must have an influential voice in determining the way in which care was delivered. For center directors like Dr. Rodney Powell and his staff in Watts, community involvement means working with his health council, a management group made up of concerned community members selected by their neighbors.
We had an opportunity to work in clinics, and many of them, we know that.
Mrs. Moore, I think one of the biggest problems is the lack of understanding what the team really means, and the person plays the key role has not had the kind of training that I think you prescribed for him initially, and that's the neighborhood health agent. These are people who are serving in that interpretive, communicative advocacy role back to the teams, and no one pays any attention to him. He's still not accepted. The doctors regard him as someone less than a professional, and the people, such as the social workers and the public health nurses, still haven't accepted his role.
That's because he's dealing from a position of no power.
What do you mean by that?
That he's dealing from a powerless position, and that's why he's not recognized.
Well, that's the conflict. Let me identify it right here. The conflict is that we can get people in who can do this. In my experience, the Community Health Council is one of the vital channels of communication that serves our center. You just can't get to the heart of things by using statistical surveys. You've got to get the community itself to identify its health needs and wants. The consumer input is absolutely essential, and it must be in the context of full partnership. We get consumer participation from the patients themselves, the employees at the center who are community residents, and most significantly, the community residents who are members of the Community Health Council, the board of directors who set program policy for the center.
A doctor's supposed to be able to make contact with anybody regardless to the level of the person.
At the same time,
the implications for the future of this new kind of health care are complicated and intriguing. In all of their activities, whether medical, dental, pharmaceutical consultation, or laboratory, the centers work with a medical institution in their area, usually a medical school, teaching hospital, public health department, or established group practice. A new way to deliver health care? Yes. In a great many important ways, it is. And here in these centers, with their ties to the communities they serve, they are training neighborhood people to take their part in it. The training programs include not only dental assistants, family health workers, laboratory technicians, x-ray technologists, and other health specialists, but also key punch operators, switchboard operators, record specialists, and secretaries. When their training is complete, these people will be equipped to fill needs at the center itself, or go out into their community and work in other facilities. By creating new wage earners, the neighborhood health centers are helping develop the financial health of the community as well as its physical health.
It's new, and it's challenging, and it's frustrating too, because the problems aren't all solved yet by any means. There are still patients whose needs aren't being entirely satisfied, still health workers not entirely at home with this new concept of care. The system is evolutionary, and in its evolving, it is inevitably confronting tough and complicated issues, such as recruitment and changing professional roles and others. But the neighborhood health center idea is well launched, and its implications are far-reaching. As a flexible system which emphasizes full involvement of the consumer himself, the health center principle may well be useful not just as medicine for the poor, but for medicine as a whole.
In King City, California, where the Southern Monterey County Medical Group operates the center, Dr. Len Hughes Andrus and his colleagues have successfully proved that private group practice can work closely with government agencies to fill gaps in health care with new services and manpower.
We, I hope, represent a real working partnership between private physicians and government working towards the same goal. And so far, we've had excellent relations with Washington, and we've had real thrilling experience of bringing better medical care to people who never before have had adequate medical care in their lives. In the development of our program here, the OEO encouraged us to develop any innovations that we were capable of through our own initiative and imagination. And I feel that if this grant ended tomorrow, that we would never go back to practicing medicine exactly the same as we did prior to the grant, even with our private patients, because we've learned techniques and used techniques of delivering medical care that have changed our entire pattern of practice for the better, I'm convinced.
It's a beginning, and while it's far from perfect, it's light years away from what was there before. This family health worker is an expert on that.
You have to live in this neighborhood. You have to really be here to know what it was like before. And what a wonderful thing now has happened for the people's health. The center has not solved all the problems of schools and houses and trashy sidewalks. But for my friends and my neighbors and all the people who live here, to them this center is a very great thing. And talking for me, it is a great thing too.
When you built your center yourself, as they did in Alviso, on opening day you come with special prayer and thanksgiving. Opening day, the beginning of something important. From this day, the people of Alviso will have a health center of their own. And it is their own, in the special way that anything you build yourself belongs to you. Community action? This entire health center is evidence that there is such a thing, and that it can work. Perhaps it's more visible here in Alviso than in some other areas where the ideal may be more difficult to obtain, but it can be done because they did it. So, in future days, when they come here to have their sickness treated and their hurts made well, you can understand it if they feel very much at home. That's part of what it means to have a center.